What's up, y'all? Let's talk Pitocin. Pitocin is the most used drug in childbirth across the entire globe. And I think it warrants, because it's so used, it warrants a little investigation curiosity around the drug. One of my great mentors, teachers that I've learned from, Dr. Michelle Odant, who's a French OB, asked the question, are we not actively selecting against our species by not utilizing our own natural oxytocin system because Pitocin is so used across the globe? Like, what is our species going to look like in a couple years, 100 years? Like, are we naturally selecting against ourselves? That's a good question. Okay, anyways, Pitocin. In the early 1950s, the molecular structures of oxytocin was discovered, and we know oxytocin as our feel-good love hormone, cuddles, that's when oxytocin's released. It's released in childbirth, natural physiological childbirth, in lots of amounts. And however, when there's medical intervention, it's not so much. Shortly thereafter, that was discovered, Pitocin was made in a lab, packaged up, and used to manage childbirth more effectively, to induce and augment, basically create contractions and make them stronger. Now, some side effects for mom include pain, obviously, because the contractions with the use of Pitocin go from 0 to 100. There's also the possibility of hemorrhage, a higher risk of hemorrhage, fluid retention, fluctuations in blood pressure, and nausea and vomiting. For the baby, there's distress as a risk factor, jaundice, low birth weight, respiratory distress. And that list is not exhaustive, y'all. There's probably a lot more and things we don't even know about because this drug has not even been around 100 years, yet we're using it like it's Kleenex. That's crazy. So the biggest thing here I want you to know is Pitocin does not cross the blood-brain barrier like oxytocin. When a woman is in natural physiological birth, our body, oxytocin, releases our feel-good hormones. Pitocin does not do that because it does not cross the blood-brain barrier to signal to our body to release our feel-good hormones. So think about this if you're preparing for childbirth.